Hi, I'm Dr. Cherny. Welcome to Heartland Plastic Surgery. I'm a kid from the north side of Chicago. My parents emigrated. They were World War II refugees. Came to Chicago in 1950. That's where I grew up, and I went to medical school in Chicago at Rush Medical College. I did my residency originally thinking I would do trauma surgery at a big trauma center on the East Coast, Rutgers University. And that's where I transitioned after trying that for a while into becoming a plastic surgeon because I like the creativity and the art of it. What started me interested in medicine and plastic surgery is that probably a lot of it is that I come from a tradition of medicine. My dad was a doctor. His uncle was a doctor, and then his father was a doctor too. He was in World War I and died as a combat casualty in World War I. So several generations back, medicine in my family. So I think I was basically born to do this. The thing that's different about Heartland Plastic Surgery is that I designed this entire clinic. And I designed this clinic to be a low-stress environment and to be homey. If you look around, it's furnished with antiques, which I really like a lot, and it's furnished like your home would be furnished. And when you're here, we want to treat you like you are a visitor, you're a guest, a very valued guest in our home. It's nice when you go to a doctor and he's your doctor. You don't get somebody else who's on call. You don't get like a recording. When you call here, you actually talk to a human being. When you want to see a doctor, you actually see me. And there's that relationship that I have, and I understand you, and I know you over a long period of time. I understand you. So that's why I opened a private practice, because I think that's still the best model. Not this big clinics where you get somebody different every time. You get me. Another distinction that we have is that I'm only a plastic surgeon in central Iowa that has the Certificate of Advanced Education in Aesthetic Surgery. And that's something that's hard to get, and you really have to study and pass extra examinations and special qualifications to get that. You have to be on the cutting edge and be with the latest technology. Well, we all have our motivations, but what we do differently is that we don't have a patient come in and I don't tell them, well, you need A, B, C, D, E, F. I don't do that. I have a patient come in and we listen to them and we try to find out what their motivations are and what bothers them. You'd be surprised, it's sometimes not what you think it is. And so we let the patient tell us what bothers them, and we give them options on how to fix it. It's funny, people tell me that my job description should just be I'm the guy who makes women happy. In the end, what gives me the satisfaction is when a surgery is done and everything comes together. It's the right surgery on the right person, it goes well, and they're happy. In summary, I would say I'm happy when my patient is happy. And that's regardless of actually the type of surgery, because people also ask me, do I have a favorite surgery to do? And I would say, yes, it's a surgery that makes my patient the most happy. The happier the patient, the happier I am.